Does a pinched nerve in the neck cause upper back pain? The answer may surprise you. Many of my patients come to me because they have upper back pain or upper shoulder pain way below the neck area. And they often say, Dr. Walter, I have a pinched nerve in my neck that's causing me this upper back pain. Well, is that even a connection? Is that even possible? I'll explain more in this video. Hi there, I'm Dr. Walter Slubro. I'm a corrective care chiropractor in Vaughan, Ontario, Canada. And what this channel is about is giving you tips and strategies on how to strengthen, stabilize, and correct your back. And also introduce you to corrective chiropractic methods. Like this, you can bend, move, and lift normally without pain and limitation. If you want these tips and strategies, you want to learn about spinal corrective care, do subscribe right now by tapping on the subscribe button below. Tap the notification bell. Like this, you don't miss out on my weekly video updates. Also, if you're brand new to my channel and you just subscribed, let me know in the comments below and I'll personally reply back to you with a thank you. So before I answer the question, does a pinched nerve in the neck even cause upper back pain? Let me just kind of explain a bit about that pinched nerve sensation in the neck and some of the anatomy around it, okay? And then I'll give you a better understanding of the actual answer. And then I'll actually show you the connection between the neck and the upper back pain, okay? So here's the cervical spine, which is your neck. So it's a straight alignment from the front, has a circular shape from the side. That's normal alignment. There are 7 vertebrae, and from C2 to C7, there's a disc in between. Inside is the spinal cord, right? And the spinal cord branches out into these spinal nerve roots, and eventually they go into the arms, especially the C5, C6, C7, C8. There's a C8 nerve, and then a T1 nerve. They go into the arms, right? And then the upper nerves here go to the head and face area, and the lower nerves and the thoracic go into the thoracic region. But the lower cervical nerves go into the arms. So when this nerve that comes out of here gets irritated, it's been often called the pinched nerve. So a pinched nerve can be a compressed nerve, right? And what can cause that is typically something like a disc bulge can cause that. So disc herniation or disc bulge, or arthritis degeneration, or sometimes even a misalignment of the spine where it's kyphotic or military neck, or some kind of distortion or of that spinal alignment can irritate that nerve and cause radicular symptoms, often been called the pinched nerve. Okay, so that's what the anatomy of the spine area relates to when we're talking about a pinched nerve. So can a pinched nerve or a compressed nerve cause upper back pain? And the straight answer is no. The reason why is if there's nerve compression or a pinched nerve, the pain or the pain distribution will be along that nerve path. And the nerve path does not go to the upper back around the shoulder blade or under the upper traps, okay? And I'll show you in the actual nerve chart in a moment. So the nerve path actually goes into the arms, forearm, and into the palm, hands, and fingers. So let's walk over to the nerve chart and show you what I'm talking about. So let me show you the nerve distribution of those mid to lower cervical spinal nerve roots. If you look at the nerve chart over here, so here's the neck, and you'll see the lower nerves over here, C5, C6, C7, C8, T1. They make up the brachial plexus. So here's the brachial plexus, brachial referring to arm, and these nerves feed into the arm, forearm, hands, and fingers. So when there's a pinched nerve over here, a compressed nerve, a nerve irritation here, yes, it may cause local pain in the neck, and it will cause radicular, radiating, or referring pain down into the arms, hands, and fingers, like numbness and tingling, but it won't usually directly cause upper back pain, okay? Because that's not where those nerve distributions go. So the upper back pain has to be from another source. It can still be from the neck structures, but not so much the neck nerves. So let me show you another poster to give you some information on why there can be a referral to the upper back from your neck, but not so much from the nerves. So let me just cut into the next shot, and I'll show you this next poster here. So here's a poster that shows referral patterns from the facet joints of the cervical spine, the neck, okay? So not so much nerve radiating patterns, okay? That's what the other poster showed you. And I love this poster. It's actually designed by Chiropractic Biophysics, and they reference 2 studies, so this is research-based, and the studies are in the Spine Journal, Study 1 and Study 2, 1990. So it's a well-established spinal journal, well-renowned throughout the world, so it has a lot of reliability and validity in this journal. Okay, it's also peer-reviewed. And what they've done in this study is they've taken saline solution and they've injected it into, of course, with permission and with consent, but they've injected the different facet joints of the neck, and they asked the patient where they would experience any irritation or any exacerbation of pain or any production of pain after they got those facet joints injected. And what they discovered, I'm not going to go through the entire patterns of all of the facet joints. I have another video that talks about this, and I'll link it in the description below, so take a look at that. But they discovered that when the C5, C6 facet joint was irritated, and what I mean by irritated, right? So they're irritating it artificially with saline solution, but think about like whiplash injury, think about bad posture, think about spinal distortions or misalignments, military neck kyphosis, cervical kyphosis, anything that can strain those capsules and ligaments of the joints, right? That's an inflammation, that's a joint injury, and the referral pattern of C5, C6 is this shade purple here in the upper trap region just above the shoulder blade, okay? And then the referral pattern of C6, C7 facet joint is this blue shade over here, okay? So yes, the neck can refer pain to the upper back from facet joint referral patterns, especially in the lower facet joints, the C5, C6, and C6, C7. But typically that area, if there's a pinched nerve in that area, nerve compression, it will not typically distribute pain to the upper back because those nerves do not go there, okay? Like I said earlier, the other posterior, those nerves go to the brachial plexus and into the arms. So again, just to summarize, that nerve compression, pinched nerve will typically cause symptoms into the arms, hands, and fingers, not the upper back. And then facet joint irritation in the neck will typically cause local neck pain and also referral patterns into the upper shoulder if it's the lower neck region. So now I have a better understanding of the nerve distribution of the cervical nerve roots that go into the arms and how that causes those radicular symptoms, whether it's a C5, C6 pattern of radicular symptoms or C6, C7 lower neck, and how a pinched nerve doesn't directly cause upper back pain symptoms. And now you know where one possible source of upper back pain symptoms can be coming from, which is the cervical facet joints or the cervical spinal joints, okay? Now, sometimes there can be two scenarios where you have the facet joints that are irritating the neck and causing pain distribution to the upper back. And then you can also have that irritation or compressed nerve that's also distributing numbness pain down into the hands and fingers. So they both need to be addressed with some strategies that can be coinciding together and also some strategies that may not, okay? So, and if you're looking for more information about a C5, C6 radiculopathy or C5, C6 disc bulge as relates to nerve compression and hand pain and radiculopathy into the hand, and even see some exercises that may be useful for it, go ahead and watch this video right here to get those C5, C6 disc herniation exercises and C5, C6 disc bulge exercises right over here.